Thank you for having us. We're really excited about this panel. I just want to start by saying, like, never mind the Muppet. Never follow a preacher's kid. So we have a really great panel today, and what we're going to try to do in this panel is have a conversation among people who are on the front lines of community-based advocacy around environmental justice, and people in the academic community, and people in the advocacy community. And I'm going to ask questions of each of them that asks them sort of to take off their hat and wear others about some of these issues. So I'm excited to have you all here, and we're just going to get into it. I'm going to alternate questions between Della and Aisha, and then at the end sort of bring Mustafa into the conversation as well. So I'm going to start off with Della. My work is currently international, and it focuses a lot on using evidence to guide public policy and around environmental health concerns. So I want to ask you, you're a fellow now, you're in an academic institution, but you've been in a community-based institution. What are you and academic institutions doing around translational work for policy promotion, and how do you balance quote-unquote objective science with policy advocacy?
Great. Well, I'll just start by giving maybe a little overview of the work that I do. I'm Della Wright. I'm an evaluator and assistant division director at the Deep South Center for Environmental Justice in New Orleans, Louisiana. And most of the work that I'm involved in there is called the HBCU CBO Gulf Equity Consortium, a lot of acronyms, historically Black colleges and universities, in partnership with community-based organizations in 5 communities across the Gulf Coast from Houston to Pensacola, who are facing environmental justice issues at different levels and usually in a lot of combination. So a lot of different issues being faced by single communities. So what they mostly have in common in the Gulf is, of course, vulnerability to climate change, vulnerability to disaster, but also proximity to chemical, oil and gas refineries, to air pollution, water and soil pollution, port expansion, a lot of industrial projects, and a lack of transparency from local government around what really is in our neighborhoods. And so to your question about balancing research or objective science and policy, I think they really go hand in hand. And so especially in environmental justice communities, the use of citizen science, also known as community-based participatory research or the communiversity model, or goes by a number of different names, but the idea that science is not only the purview of people in academic institutions. Research can be done by community members at a level that is as rigorous as that comes out of academic institutions. And so not setting up that kind of false dichotomy between researchers and community members. Oftentimes researchers come from communities who are affected by these issues, and we need to not erase those people as well. And so the research that we do is always there to fuel the advocacy, to fuel the policy change. And the agenda has to be set by the people that are most affected. So I could think about an example, Dr. Ali mentioned Houston, Texas, a lot of air pollution that happens in Houston, Texas. One of the communities we work in is called Pleasantville, also faces a lot of those same issues and a real lack of transparency around the air pollution that is in their neighborhood. And so the community organization that we work with there has purchased air monitors, is doing it themselves, is stepping in where government has failed to collect their own data, to analyze their own data, and to make it transparent so that everyone in their neighborhood can see what exposures are happening and take that and use it to advocate for policy change that will make them safer and healthier.
Thank you. I mean, I'll follow up with Aisha. There's no question that inquiry into environmental health has really evolved dramatically over the last couple of decades. You've been an investigator. Could you comment a little bit on how you see the evolution of inquiry into environmental health disparities and environmental justice, and what kind of challenges are faced by investigators like you, rather?
Yeah, that's a pretty good question. So I'll say, unfortunately, years ago, we'll say many years ago, investigators would just come into a community, collect some samples, write this fantastic paper, publish it in the New England Journal of Medicine, and say, look, lead is bad. Pesticides are bad. And then they go back to their offices and that would be the end of it. So the issue now is that a lot of researchers have gone back to the same communities repeatedly, and that has contributed to building a bit of mistrust with a lot of academic research institutions. So I'd say, as someone who does this kind of research, it's important to build the kind of community collaborations that Della spoke about. If you want to work with the community, it needs to be with the goal of having this long-term collaboration where you're not just publishing papers, but you're coming back, you're speaking at those town hall meetings, you're telling people what you found, and then you're working to mitigate the issues that you've seen.
Thank you. I mean, you're a neuroepidemiologist, right? Do you want to sort of maybe tell folks what kind of research you do and how it engages communities, or how it could?
Well, sure. So primarily, I look at environmental risk factors for neurological disorders, a lot of heavy metals. So I'll use lead as an example because it's something that a lot of people know about, right? So when you think about lead, if you remove the lead paint from a home or something like that, the damage is really already done. The lead has already stored in the bone, and as that child ages, it begins to remobilize, and the child is re-exposed to that lead. So then you look years later at the development of the child, and now they're not doing well in school, they're having trouble with behavioral issues. So those are the kind of outcomes that I look into, because even though you've removed that lead, you have to look at the consequences of the exposures that have already happened.
Great, thank you. Della, I wonder if you could talk a little bit about sort of one of the essential problems in public health inquiry in general, but certainly environmental health inquiry, is that the science often really lags. It's difficult to collect. And in many cases, communities ask for evidence to be gathered, only to discover that either it's very difficult to do so, or when the evidence is gathered, the findings actually are negative, or they don't sort of nullify the null hypothesis. You can't conclude that anything has happened. Can you sort of talk a little bit about sort of what the implications are on the ground in communities for that kind of phenomenon and what you do about it?
Sure. I think that's a really important question because it's definitely one of the biggest tensions between researchers and community members when they're not working together, is setting up those expectations that there are limitations to science and the research that we can do. And just because we can't prove something doesn't mean that it's not happening. And I think that's really important to set up from the beginning. A lot of times people want you to be able to say definitively at the end of the day, X, Y, and Z refinery caused my loved one's cancer. That's not always possible, and it's really difficult to draw those causal links. So I think part of it is really being creative about the science that you use and the different outcomes that you look at. So just because we can't maybe get a slam dunk, we can definitely still build a case that exposures are making people sick, or that they're doing other things that are negative that people should be held responsible for. So I think about there's a community that we work in Pensacola, Florida, which is like 3 adjoining neighborhoods that have 13 landfills across this really small area. 13 is a lot. And in a residential area where there should be 0 landfills. What happens is, permits have been issued to excavate large lots because they are built on the type of soil that's used to build roads, as well as the sand that they take and put on the beautiful beach in Pensacola. And so those lots are excavated, and then when there's a big empty hole, people throw trash in it. So they get turned into pits, unlined waste pits, as well as more official landfills. So it doesn't take a lot to know that that's making people sick. The people who live there know that it's making them sick. They might not be able to prove at the end of the day that the levels of hydrogen sulfide in the air are what's causing their illness, but what we can do is get air monitors to say that the levels of hydrogen sulfide are too high, are not compatible with human health, and are, over the limit. And so we can work on that. We also can say, it's not only causing harm to our health, but it's causing our quality of life to be diminished, our property values to disappear. We can start building a case for those things as well. We can, and they have used GIS mapping to take publicly available data and say the air that we're breathing in this neighborhood is not the air that people are breathing in the white affluent communities 2 miles down the road. And so when you have the power to bring that to your lawmakers, it may not demand that they make a change. And I think at the end of the day, that's what's hard to accept is you can present all that and they can still push you out the door, but it does kind of start to build a case that requires at least a response. And so I think that that's somewhere to start.
Yeah, so you've described a way in which without necessarily leaping straight into the demonstration of health impacts on a community, you've leaned on the science to describe the hazard, a level of exposure that previously may have been linked or is regulated at a level which is linked to health outcomes, right? And that's very, yeah.
Oh, no, I was just saying yes.
Okay. And then maybe, Aisha, why don't you sort of answer this first, and then Della second. I want to sort of think a little bit about the evolution of the environmental justice movement. When I started doing this kind of work many years ago, I think that it would be fair to say that there was a perception in many communities early on in this effort that they bore the disproportionate burden of public works projects, of polluting industries. And often the mobilization only began with the initiation of a new project, when people would be sort of outraged in many ways that they bore this disproportionate burden. And I wonder if both of you can comment a little bit on the evolution of the movement from one that is reactive to proactive. How has that shift influenced work in inquiry and work in advocacy? Aisha?
Sure. So going back to what I mentioned earlier, when you have a huge industrial facility in your neighborhood, the EPA might come in and try to clean up the situation, right? But by the time they clean it up, the water aquifer under wherever that was sitting, your water source is already polluted, right? If you have this dirty soil and you clean up your neighborhood and you build this community garden, now that garden is soaking up those toxicants. And I think people are now starting to realize, even though they've cleaned up these areas, they're still experiencing these exposures, even with fish, right, along the Gulf. So now people are thinking, you know what, instead of trying to clean it up, let's be more proactive. Let's prevent these industries from setting up in the community to start with, right? So that's what people are trying to get more involved with. I'll say that environmental justice goes hand in hand with social justice. And there's been a large incline in social justice and advocacy here lately. And I'm hoping that that contributes more to the environmental justice movement as a whole. But we'll see as time goes on.
And just a quick follow-up, how does this sort of change in sort of both understanding, the depth of understanding about these potential risks, how has it sort of influenced the sort of academic world in terms of the topics that you select for research, the sources of resources for doing some of that?
I mean, in my experience, most of the people who do environmental justice research are people who have seen it firsthand. The thing about working in academic research is that you really have to put a lot of your time into what the government decides to fund. So in order to do environmental justice research, we really need more of a buy-in from NIH. And thankfully, places like the Bloomberg philanthropies have been putting money into these kind of projects. So even if we don't have all of the federal funding we need, there are a few foundations that are trying to help out with the cause as well.
Great. Aisha? I'm sorry, Della?
That's okay. Yeah, I would agree. I think that the shift towards being proactive rather than reactive takes time and is only available to people when they aren't constantly having to react to issues. So when you live in a place where there are many, many exposures, which are all around the country, but I think about just because I live in the Gulf South, there might be a chemical refinery a mile down the road in every direction. There might be, you are vulnerable to flooding and to disaster and to climate change. it's really difficult to move into a proactive space when you are so disproportionately burdened. And I think that while many communities would really like to be acting from a place of moving forward, they are struggling to get out from under. And so I do think, though, that the partnerships that are available now that environmental justice has come a little bit more to the forefront of discussion, I think help to, while localities are kind of mired in the issues that are deeply affecting them on a day-to-day basis, these partnerships might allow some of us, like convening organizations, academic organizations, to be able to zoom out and make those connections that start to build a strategy that can be used for more long-term change.
If I could just chime in, because
Please.
I would be doing a disservice to environmental justice if I did not point out the fact that there are a number of communities and organizations who are revitalizing their communities, even in the face of the challenges that are going on. So everybody in this room probably has a cell phone. So you should Google the Environmental Health Coalition out of National City in San Diego. You should Google the Ivanhoe community in Kansas City. You should Google the Regenesis Project out of Spartanburg, South Carolina, that took a $20,000 grant and leveraged it into $300 million in changes in their community. And the communities are the ones who led these efforts. So yes, there are impacts that are happening inside of our communities, but there is also critical thought that's going on. There's solutions that folks are moving forward on, and sometimes doing it even in a bipartisan way if you look at what happened and continues to happen there in South Carolina. So we can make change happen, and that will then push people to make sure there are better and stronger regulations. It will push people to say, we can invest in these communities, and it will not only yield positive results, but it will also be strong economic drivers. Because if we don't address the economic issues that are also happening in our most vulnerable communities, they will continue to be the places that people place all the things that we don't want. They will be the sacrifice zones. So that's why we have to have a holistic strategy.
Yeah, thank you for that. I think that I think that's a nice sort of transition from the panel to the audience. It's very difficult in these times of attacks on the integrity of science, on the attempt to retrench long-standing health-based regulations, to really feel as if there's sort of opportunity and hope. And I think the notion that mobilization is really the key to that is really critical. I want to leave an opportunity for some questions from the audience. The glare makes it difficult for me to see, but if anyone has questions for the panelists, we'd like to give you an opportunity to speak. So does anyone want to? Okay, I see a hand over there. Do we have a runner for the microphone?
Thank you. I was curious if you could talk about that so many of these problems are rooted in the invisibility or the sort of perceived invisibility of both the problems and the communities that are most affected. That we treat trash as sort of like, an issue that just disappears once we put it in the can, or the air pollution, and doesn't really matter if we don't see it. And how you get, how either through science or advocacy, you get people to understand that people that they don't see every day are real, and the harms that are experienced by them are real, and that even dangers that they can't see are still real.
Yeah. It's a great question. I think it's a real challenge because it's hard to make people care who don't care. However, I think that, as Dr. Ali kind of pointed out, the communities who are facing these are not by any stretch invisible, and are not willing to stay invisible, are doing incredible work, are screaming for help, and also helping themselves. They're not waiting for anyone to come save them, and they never have been. This is a movement that's been in place for decades, and I think is only moving forward. And so I think that what we can do to help solve that problem is making sure that we're amplifying those voices and not taking up too much space, I say, as I sit here on this panel. But I think that it's not hard to find people who are willing to talk about the things that they're facing, and who have been facing them maybe for decades and generations in their own neighborhoods, who absolutely, the problem may seem invisible to the outside, but they're living with it on every single day. And so I think you really just have to be, we have to be making sure that we're making space for those voices to be heard, because they're absolutely there.
I think it's going to get easier to a degree. I mean, there's always going to be a lot of difficult work that happens, but now because of climate change. So here's the dirty little secret nobody ever talks about. So the majority of the fossil fuel facilities, those greenhouse gas emitting facilities, are located in communities of color and lower income communities. And for decades, they were asking people, pay attention to the siting that's happening in our communities. Pay attention to these public health impacts that are happening. And that same pollution that had been killing them and making them sick is now warming up our oceans and warming up the planet. If you look at the fossil fuel infrastructure, those pipelines, when you saw people at Standing Rock and other places bringing attention to that, we got 2.2 million miles of pipeline in our country. And that primarily runs through indigenous land, through low-income white land, farmers' land, and it ends up down there on the Gulf Coast, as the sister said, right there in Port Arthur, Texas, and in the Manchester community and all these other places. All of that is playing a significant role in climate change. So it is helping to bring attention to what you raised for some of those issues, not all of them, that garner folks paying, getting more engaged in the process, because now, remember the phrase that we did at the end, where we're all in the same boat now? Climate change is making sure that folks understand that everybody is going to be impacted, and that's why you're going to see more and more people getting engaged in these issues.
Okay, another question I think I saw. Okay.
Thank you. And just, so much of what you talked about impacts the world. Sorry. So much of what you talked about impacts the same communities are impacted by unemployment, by bad over-policing, by the opioid epidemic. How are you working with other movements, and how are other movements reaching out to you?
You want me to answer?
That sounds like a question for you.
Yeah, so there's this misnomer that people think when folks are focusing on environmental justice issues, it's just an environmental issue. And then for those who are a bit more evolved, they understand that it's also public health folks. Environmental justice is dealing with housing justice, transportation justice issues, economic justice issues, public health justice issues, democracy or the civic process justice as well. So it is and has always been a holistic movement. An intersectionality movement now is the word that everyone wants to use. And if you go back to the first set of principles in 1991, the first People of Color Summit, you would see that there were all kinds of different folks coming together to address these issues that are happening in our community. So thank you for raising that, because what we're dealing with the extraction of wealth inside of communities, the extraction of power inside of communities. And as we begin to change that paradigm, then we are able to bring all these various folks together.
Yeah, I would just add to that by saying I completely agree. I think that all of these movements really fit together. I started my work in reproductive health, and the leader of the organization I work for, Dr. Beverly Wright, is a seminal environmental justice scholar who also began in teen pregnancy prevention and said there's no point to doing this when people can't have healthy children because of the environmental exposures that they're experiencing. And so I think about how to kind of center all of those issues at the same time. The environment is the home we live in. It's the world that, of course, every issue takes place within it. And so making sure we have a safe home for all of those things to happen within is really crucial. I would also just say that the way to make that happen is funding community work. And when academic institutions are funded and when convening organizations are funded, making sure that those resources are shared and that we're not throwing pennies to the organizers on the ground who are doing the vast majority of that work. And so equitable funding is definitely, I think, a priority that helps that happen.
And diversify our boards and diversify our organizations and make sure that, it looks like America and that people's voices truly have power. And I'll leave this last point. When we have summits and conferences and we look around the room, we should see frontline communities sitting in those chairs as well and making sure that it's affordable for them to be in the spaces.
No, I have nothing to
add. I want to thank our fantastic panelists who are doing incredibly important work representing frontline community-based work and the promotion, support, and evaluation of that work, important academic research that creates foundational information for understanding the relationship between health and the environment, and that's working with communities across the country and formulating hypotheses and actually getting the research done, and in advocating for high-level policy change to translate, to use, to consume this kind of data and information. Amazing research is going on here at Johns Hopkins, and so I invite all of you to sort of probe and to check that out. And with that, I want to thank our panelists.